Breast cancer is one of the numerous illnesses in women that have caused them sleepless nights. This type of cancer has been identified as the most common type of cancer in the world. India has been ranked among the top countries that have been hard hit by this cancer. Breast cancer in India is held responsible for causing a little over 10,000 number of women deaths in India per annum. This type of cancer occurs as a tissue tumor in the breast. In different cases, the tumor can turn into a hard lump of tissues or remain as a soft tissue tumor. In both cases, the disease is still quite deadly and easily gets out of hand if not properly handled. Soft tumor breast cancer in India is estimated to be present in at least one woman in every 8. The disease is not only found in women as in the recent past, but there have also been notable cases of men suffering from breast cancer. However, the ratio of men to women suffering from breast cancer in India cannot be exactly determined. This is because of the fact that most men who suffer from breast cancer do not disclose their status in public. This is because of the stigma associated with breast cancer in men.
Causes of breast cancer. The number of people who suffer from breast cancer in India has been on a rapid upwards trend. This implies that more and more people continue exposing themselves to cancer-related conditions day in day out. There are no specific causes that lead to breast cancer, as it is mainly a lifestyle disease. In specific, breast cancer in India has been attributed to unhealthy lifestyles led by most ladies. This disease has no exact cause, and as such it is very hard to prevent chances of its attack. The chances of one getting breast cancer are attributed to several risk factors. The most prominent risk factor is age. As the age of the woman progresses, the chances of her getting breast cancer are very high as compared to younger women. Breast cancer in India is noted to mainly attack elderly women of advanced years. Family cancer history can also contribute a great deal towards cancer attacks. In families where the disease has been noted before, there is a very high chance that another person from the family will get cancer. In a research done on breast cancer in India, it was proved that 22% of all breast cancers here are mainly due to family history. Women who experience their menopause after the age of 50 also stand a high chance of being attacked by breast cancer. Breast cancer in India is also very common in women who have kids after the age of 30. The main causes of cancer are controllable, and as such you should ensure that you regularly visit the hospital for checkups and early treatment. Common signs of breast cancer. There are commonly no physical signs of breast cancer. However, there are several signs that can be said to be an indication of breast cancer attack. Such factors include fluid discharge from the nipple and redness around the breast's nipple. In most cases of breast cancer in India, these two factors are nearly evident in every single woman suffering from breast cancer here. Pain in the breast is selective, as not all women suffering from breast cancer experience it. Other signs include irritation and pain around the nipple area and point. If you by any chance experience any of these signs, you should immediately contact your doctor for an early screening. Breast cancer in India and other places all over the world can actually be controlled/treated upon early identification. As such, you should regularly visit your doctor for checkups. This helps in early identification of the disease upon attack. Treatment procedures of breast cancer. Cases of breast cancer in India are treated in specialized hospitals that deal with cancer treatments. This is because of the fact that cancer treatment requires specialized skills and equipments. Breast cancer treatment varies from one stage to the other. This is due to the fact that the disease's severity varies from one stage to other. As such, the severity of the disease in the first stage is quite minimal and therefore can easily be treated. On the other hand, the severity of the disease is quite high, therefore treatment options use more detail. Most cases of breast cancer in India were identified between the first and third stages of the illness. This makes it quite easy to be able to treat the disease before it gets out of hand. There are many cancer treatment options available, and most times doctors use a combination of several treatments in order to cure the illness. However, the most common treatment option used for breast cancer in India and all over the world is surgery. Through surgery, it is possible for doctors to remove the cancer tumor in the patient's breast. At times, doctors can use surgery to chop off the whole breast, especially in the last stage of the disease. Even so, when the disease is not at advanced stages, it is also possible to remove part of the breast as opposed to the whole breast. Most patients of breast cancer in India have their breasts removed, as the disease is very severe in India and Asia at large. Breast cancer in India can also be treated through radiation therapy. This is a situation whereby the doctor exposes the region affected by breast cancer to radiation beams. These beams are used to kill cancerous cells in the breast. However, this medical treatment option is only possible for patients who are at the early stages of the disease. Breast cancer in India has been dropping at a very high rate. This has been as a result of great public awareness that has enabled women here to go for regular medical checkups. Most cases of breast cancer in India have been identified at their early stages, and it has thus become quite easy to treat the cancer attacks. Cancer is treatable, and hence you should ensure that you seek medical attention immediately when you suspect that you are under attack by cancer.